Good evening. We begin tonight with one piece of good news about Ebola. Turns out the Dallas County Sheriff's deputy we told you about last night doesn't have it. The test results came back negative today. Deputy Michael Monning had been in the apartment where the only person to die of the disease in this country had stayed, Thomas Eric Duncan. Today, the hospital that treated Duncan for 10 days defended the care that it gave him. Manuel Bojorquez is in Dallas.
Today, doctors said Duncan died yesterday morning when, in spite of the intensive care he was receiving, his heart stopped. According to Texas Health Presbyterian, Duncan had previously told doctors not to perform chest compressions or use a defibrillator to prolong his life. Over the last few days, there have been questions from the Duncan family and members of the community about whether Duncan received proper treatment. Duncan's girlfriend remains quarantined and spoke through her pastor, George Mason.
She wonders, like everyone else, why it is that he was not taken in immediately, and why it took so long for there to be medication delivered, and why other people have recovered and he did not. These are her questions.
In a statement today, the hospital said Mr. Duncan's physicians treated him with the most appropriate and available medical interventions, adding he was the first Ebola patient to receive the experimental antiviral drug brincidofovir as soon as doctors determined and as soon as it could be obtained. It went on to say Duncan did not receive a blood transfusion from Ebola survivors because his blood type was not a match, and that Duncan did not receive ZMapp, the experimental treatment that was given to the first 2 American Ebola survivors, because it was not available. As to why Duncan was released after his first visit to the emergency room, the hospital defended its care, saying Duncan received a 4-hour evaluation and numerous tests before being sent home. The hospital dismissed allegations that race and lack of insurance played a role, saying Duncan was treated with the same high level of attention as other patients. The hospital says a team of more than 50 people treated Duncan, and he was cared for in a unit of 24 beds that was cleared just for that treatment. Still, Texas health officials say they are considering an investigation of the hospital's actions. And Scott, there will be a congressional hearing in Dallas tomorrow, one of the first examinations of flaws exposed by this case.
Thanks, Manuel.